We all like to think that the heart looks something like this. Something that we use when we text, the universal symbol for love, and what we draw on the back of an exam paper when we're bored. But really, we know that the heart looks nothing like this.
It is a vital organ, a double pump with 4 chambers, an integral and complex system of transporting blood through the atrium and the ventricles to return oxygenated from the lungs and move out to supply the body.
But sometimes the ventricles do not empty properly, and we quite fittingly call this disease heart failure. Heart failure is a chronic syndrome that results from the structural or functional impairment of ventricular filling or blood ejection. In order to understand the underlying pathophysiological processes, we must first look at some important distinctions.
An important distinction to make is the difference between left and right-sided heart failure. Left-sided heart failure includes an inability to properly pump out blood into the body. This can be divided into systolic heart failure and diastolic heart failure. Systolic involves the left ventricle not being able to contract vigorously, indicating a pumping problem. This is usually associated with a reduced ejection fraction. Diastolic heart failure, however, has a preserved ejection fraction, with the left ventricle being unable to relax or fill fully, indicating a filling problem. This is due to the stiffness of the muscle. In most patients, diastolic and systolic dysfunction coexist. An ejection fraction is an important measurement on how well your heart is pumping and is used to help classify heart failure. Right-sided heart failure usually occurs as a result of left-sided heart failure. When the left ventricle fails, increased fluid pressure is in effect transferred back through the lungs, ultimately damaging the heart's right side. So let's look at some reasons for heart failure.
Coronary artery disease is the most common cause of heart failure. The disease results from the buildup of plaque in your arteries, which reduce blood flow and can lead to a heart attack. It is characterized by the consequent scarring in your heart muscle and the damage to heart valves, which may force your heart to work harder, weakening it over time. Cardiomyopathy is a serious lifelong disease that impacts the heart muscle. This damage can be caused by infections, but also from alcohol or drug misuse or a heart attack. If the pressure in the blood vessels is allowed to remain high, the heart has to work against a continual overload. In time, it may not be able to maintain its pumping effectiveness. This is particularly the case with people who have diabetes, as they have a 2 to 8 times greater risk of heart failure due to this hypertension, as well as additional factors. Myocarditis is an inflammation of the myocardium. It's most commonly caused by a virus and can lead to left-sided heart failure. Another factor that can lead to heart failure is abnormal heart rhythms, which may cause your heart to beat too fast, causing tachycardia and creating extra work for your heart.
So if heart failure occurs due to these distinct pathological processes, then what does this look like in a patient?
In adults, its primary manifestations are dyspnea, edema, and fatigue. Heart failure can lead to pulmonary or splenic congestion and peripheral edema, especially in the legs and ankles. Retained water due to the kidney dysfunction also contributes to the fluid retention. If you develop congestive heart failure, fluid will sometimes collect in the lungs and interfere with breathing, potentially causing respiratory arrest.
So why do we care about heart failure?
A systematic review in 2016 revealed the prevalence of heart failure in Australia at around 2% of the total population, with at least 330,000 cases, with a notably higher prevalence in men and in the Indigenous population. But will this always be the case?
As the head of cardiology at Northwestern University, Dr. Yancey has said that heart failure is no longer about failure. Even here at Emory, researchers are working tirelessly to develop new techniques to better prevent heart failure and associated conditions like cardiomyopathy. Heart failure is something that can affect anyone, of any different age, race or gender. So, for something that we like to think of as a simple symbol, this organ is quite literally at the heart of everything that we do.